Very good afternoon to each one of you sitting here in the audience. It's a challenging task to address post-lunch. Let me make an effort. At the outset, let me thank Gupta ji for inviting me to this important event of the meeting of the International Patients Union Conference. I represent the National Medical Commission, which regulates medical education in the country. In addition to, of course, before coming here, I too was a teacher. In the context of patient care, the medical teacher has twofold different role. One, the medical teacher himself or herself is also a healthcare provider. That is one important role that all of us have to observe. The second role is preparing the new batch of healthcare providers who should have the best competence to be able to deliver the top class healthcare service to those who are needing it. So we, I believe, have much higher responsibility than a conventional healthcare provider whom you would see towards the patients. With this few words, let me share my views on the roles of the doctor to the care of patients, their roles and responsibilities, the care, and a few other issues related to ethics. There is a Sanskrit verse. Which tells it all about what it is to learn. It says, Acharyat Padamadatte. Whatever we learn in our day-to-day life to become professionals, a fourth of what I learn comes from my teacher. A fourth comes from Padam Brahmacharibhyaha, my colleagues and teachers, seniors, juniors, who also teach me. A fourth of it I get from them. A fourth I have to study myself, learn. And a fourth comes from Padam Kalakramenacha. It comes over the time. I believe that over the time is what I learn from the patients. The message is patients form an equal role as much as my teachers with respect to preparing me to be a good professional. This reminds me of my then principal. We all finished our anatomy, physiology, biochemistry classes, examination. From the preclinical, we have to come to the clinical. We would be going to the wards, etc., from that day. Our results were announced. The second year was to begin. The principal conventionally addressed all these fresh clinical students, those who are going to the clinical medicine second year, third year, and fourth year. So he was to address us, and he came and he said typically what this shloka said. He said, look, in addition to, of course, he was telling us that, look, all these days you are just college students. Now on, you ought to groom yourself to be doctors. Not just the skills of a doctor, but the behavior of a doctor. please be dressed well, please be disciplined, etc., etc. Apart from all that he said, now on, the class teacher who taught you anatomy, the class teacher who showed you how to do a dissection or the experiment in physiology lab, they may not be teaching. We as teachers may not be doing much of a teaching to you. I'm not running away from my responsibility, but mind you, you have another teacher, and she is the teacher. He said, be aware that you're going to be taught from that patient, from that relative who is teaching you, who is with the patient, and those attendants who may come and visit the patient and go, who are going to tell you about that patient, how well the patient is getting better or not, what are the other difficulties which the other relative might have overlooked. The patient is going to let you perhaps palpate, auscultate, percuss, sometimes even allow you to draw a blood sample, put a tongue depressor in his mouth, and so on and so forth. The patient knows, very well he knows, that none of these procedures are therapeutic for him, because you are not his doctor, you are only his student. He or she knows that there is no benefit by letting you examine that patient. And you are going to be examining or interviewing that person in a way in front of every other person. If I were to be seeing the patient, maybe in my chamber they would sit, I would examine and then send them back to the ward. But whereas that privacy also you are not giving to the patient, and that's the fact. In those general hospitals, we had to talk to the patient in the ward. Yet the patient will be obliging you. And all that is being done by that patient to you because he or she knows that they are contributing to the preparation of a human resource, which is the health force for the future generation. With nothing to be expecting from you, they are obliging. In addition, of course, you are learning from them. You have to be grateful, not just because they let you examine the patient, but also this attitude of that person where they are expecting nothing from you and you are examining the patient and you are learning. So your guru in future will be that patient. Please be mindful, please be grateful, please be respectful to that person from all counts. And that is something that you perhaps have to carry it on in the days to come as you continue into this medical profession. And this is something that Professor Maya, he those days was taught teaching us internal medicine, general medicine, and he was also that time the principal. We were all about to go, and he said in the class, and we were about 150 to 200 of us in the classroom, and this particular few statements that he made has never gone out of my mind. And what does that actually trigger in my mind? What does that trigger? Not in just my mind, I'm sure many other classmates of mine also that might have triggered. And I'm sure many teachers would be doing it. In many colleges, I'm sure the teachers would be saying this before these people go into the first year clinical subject. And what does that trigger? What does that trigger into these students' mind? Here I see the role of what we call as a spiritual learning. There is I'm sure some of you might actually be studying this concept of what is called as therapeutic intention. The therapeutic intention has been a subject which has attracted a lot of research in the recent years. The doctor feeling for the patient that the patient should get better has an additional contribution to the patient's getting better. This has been researched by many other means as well. In fact, many other things are called as praying for somebody else, although I am not here. He is also going to get that better. This spiritual transfer of this intent to get better has been also practiced in many schools of thought, but now the doctors have been now getting attracted to this idea of what is called as therapeutic intention. When I get a patient in my clinic, in the outpatient, whether I am a senior resident or a consultant or a senior professor, when the patient comes, what activates my mind is that left brain. What is that symptom? That symptom relates to the lungs or the heart. And what is the next symptom? Does it say it is infection? Or the third symptom, does it say it is an emergency or not an emergency, etc., etc. I have a logic built as part of my training into that left brain, which I straight away put to use the moment my patient comes into my clinic. And what does this teaching by Dr. Maya told me? The moment that patient comes with that distress, will that right brain also be invoked? Look, this fellow should get better, he is suffering. And that right brain and the left brain's activity coming together contributes to this, what is called as the outcome of the therapeutic intervention. And my skills which I have learned as part of my clinical medicine in my MBBS or whatever MD, DM, whatever courses that might be. So this issue of care to the patient from as many angles as possible from me is something that this teaching of Dr. Maya makes sure the students are prepared. It activates their right brain first. And over the course of those 3-4 years, while it would be happening unconsciously or consciously, since we have been told by Dr. Maya, and it goes on and skills go on because many other Mayas, many other professors, are teaching them, the skills are getting built into the left brain. By the time he comes out, she comes out as a doctor, the person is applying an integrated approach to the patient care from whatever discipline he or she is being taught with. But the common thing is the feeling for the patient to get better. Several other things, of course, have been told to us. I'm sure you have also discussed those issues. How do I feel for this by putting myself in the patient's shoes, and so on and so forth. In this context of making clinical approach holistic, there are a few things which the National Medical Commission and my predecessors in the Medical Council of India have been discussing this more and more, over and over again. I thought I will share a few points which are very important, which have been put into practice in the last 3-4 years, even more aggressively. One of them is called as a formal education, like what Dr. Maya did was rather informal, but what it ought to happen is what is called as changing the attitudes of the doctor to be as he is progressing at different levels of training, different levels of skills and so on and so forth. What attitude should he build up? One, of course, being a confident presenter to the patient, to being a leader to the healthcare service community. So many of the attitudes are added into that, and the way in which the person should actually communicate to the patient. This is something that we perhaps think that they will learn looking at the other medical doctors, other consultants, other PGs, but now a more formal way of putting the skill across to the individual by way of communication skills to be taught to the patient, to the doctor. And of course, subject to subject, specialty to specialty, these skills perhaps have to be molded to that given specialty. I'm sure this is also going to happen over the course of time. Once that the teaching community has been seized of the matter that this is important, communication skills are important, I'm sure more and more visibility of these changes will happen. And of course, ethics. Ethics has been all along been guided, but more structured way of taking into account ethics, not merely in clinical practice, also in our research activities, and also the ethics of the teachers to the students is also being considered to be told over the course of time. So the attitude, ethics and communication has now become a formal education material as part of we preparing the health course in the community. And lastly, before I close, maybe I thought I will share these 3, 4 observations to the group here. Just as much as we are talking of what is our duties as the doctor to the patient, what are our ethics, what are our responsibility to the patient. There is a wide spectrum of this which now we have started to teach these people, and I'm sure the course of time the doctors will be much more skilled and much more connected to the patient, and of course this connectedness will bring in different results. But then there is also a role of the patient population, which I could also be the patient myself in addition to being a doctor now. It looks like the entire community, entire society has to take this particular role, not just necessarily patients, although the event is related to the patients, but I believe this is a little more generalized agenda which I probably would like to share. Tomorrow happens to be the World Health Day. The World Health Day, the theme is My Health, My Right. It's true that health is my right, and I have to be in the best of health, and that health and that right should not be jeopardized. It's true that it's my right, but be assured that it can't be stolen. It is with you. Guarding it is only my skill. That is, as an individual, I consider health is my right. If I consider health is my right, it is also my responsibility to guard it. This perhaps has to pick up as a momentum. I know that doctors cannot wish away from their responsibility to attending to ill health, educating them, preparing them, preventing the conditions, provide easy accessibility. There are a host of other responsibilities as a health department, as doctors we need to take part and be making it available to our patient population. But at the same time, when I am saying health is my right, I also have to make an effort to guard it, which means each one of us, independent of me being a doctor or a patient, need to consider it as another movement to be able to make sure my health is guarded. In this context, I have to narrate a small anecdote which a group of students, all were medical students, had come for some conference. I'm not sure what event they had come, I can't recall. I was in the airport, they were also sitting. Since I heard the conversation, I thought they were medical doctors. And since on the phone, I also was talking to somebody, they must also have suspected that I am some big fellow in medical education. So one of them came and spoke to me saying that, are you so-and-so? I said, I am so-and-so. By the time I was sitting there, they had taken my photographs without me knowing that I was making a phone call. And they had gone through the whole thing. And I mean, the smartness in technology, thanks to Guptaji, they have made IT available everywhere. So they also did that research. By the time they came to me, they had researched me. They knew, they had bared me. But then they asked me a few questions here, and the conversation went on. In the meantime, the announcement came that the flight is delayed by another 40 minutes. So the conversation continued. So I asked them, you're all doctors, you're all going to be doctors. There is something called as Vikasita Bharat, which the Honorable Prime Minister has spoken about. You would all be in your good productive age during that time. What do you see as Vikasita Bharat? I was deeply shaken by their answers. In fact, if I was not my age, I would have simply prostrated in front of 2 or 3 of them who spoke so well. One of them said, Vikasita Bharat, sir, what we want is the number of beds in this country should have been halved. We are always being told that you should increase medical colleges, increase medical college hospitals, etc., etc. This man is talking of beds to be halved. He said, we will make sure, sir, the country is so healthy, nobody will fall ill to go to the hospital. To me, I thought it was a dramatic answer. Then I said, what else would you want it to happen? He said that the movement from doctors to us will change from us to you, public to you. Public will guard health so well, that's what I wish it to happen. The number of doctors you are producing in medical National Medical Commission, it half. Arey Baba, we'll all become jobless. Those who make other half, you send them to other countries. And the third point was even more interesting. Third point, of course, it was a more enterprising model he spoke. He said, no expenditure on health should happen in our country. We should earn money for educating or health care from other countries, and that should be, whatever are the returns, should be spent on any meager health responsibilities that are required for our country. Our country should be very good in health, should be very good in medical education, so the whole world is taken care of. And he promptly said, Sarve Santu Niramayaha, and we should be responsible for that. I really got very touched. If I wasn't in the grey-haired scenario, I would have prostrated to him. So my feeling is the society is changing, even the medical education, perhaps with this AdCom, I don't even know where these people got these ideas from, but I believe it is a very, very progressive idea. I think younger generation is getting from wherever they are getting this resource from. At the same time, our responsibilities for health should increase, and for the health of the individuals in the society should increase, and not just only for the patients who are in the great need, but I think they are equally responsible. At the last line, I forever remain grateful to those patients who made me be what a physician or what a psychiatrist, what as an expert today I am. So with these few words, I'll stop here. Thank you, Gupta ji, for letting me come in. Thanks all of you for bearing with me in this lecture. Thank you very much.